everyone out there in podcast land. Welcome once again to the Dental Practice Fixers podcast. I'm Dr. Richard Maddow.
Along with his brother, Dr. David Maddow. How are you all doing? Welcome back. Hey, Rich, I am ready for another show because I don't know if you remember this, but at the end of last week, we said we're going to do what's ever possible to try to get somebody to pass this time. So will we achieve it? I don't know, but let's hope we can.
Let's hope we can. Hey, something funny happened to me.
What's that?
5 minutes ago. It just reminded me that maybe just a little quick tip to our listeners. I was coming back home into my condo. I walked through the lobby, and somebody here who knows me, who works here, looked at me and said, "Oh, welcome back, Dr. Meadows." And I'm thinking, like, Dr. Meadows? Like, you don't have to call me doctor. I don't care about that. I prefer to be called Rich. But when you get somebody's name wrong, it just never leaves a good feeling, does it? I know our name, like, I know, what have you been called before? Like Maslow, Meadows, Madonna Canna, I don't know what.
Maddow.
Mutto, I know Marshall used to be called.
Mutto.
Right. So I'm going to say, if you're not sure how to pronounce a patient's name, and do this when they have their first visit, please. Just ask them. Please, tell me exactly how to pronounce your name, and then write it in the chart phonetically and never get it wrong. It's just rude, and it leaves a very bad feeling when someone's name is mispronunciated.
Not only that, if you're visiting somebody in another town or city, make sure the worst thing you would possibly do is mispronounce the name of somebody else's town. I mean, make sure you get that right as well. So
absolutely, just all the above.
Even if you need to ask somebody like very slowly and clearly, just tell me exactly where we are. Right. So that always works too. Rich, always. By the way, I think we might get. We might get harassed on social media because did you see like a week or two ago, somebody posted something. It wasn't about our podcast, but this expert was talking about podcasts in general. And he said, he's a doctor, and he said, I've got advice for those of you that are doing podcasts. Get right to the point. Nobody wants to hear your stupid banter for the first 5 minutes. So just get right to the point. So I think we're violating his. Fortunately,
I didn't see that post. Was it from just a regular old dentist out there? From a
really good guy. I think he was a little bit off on that. He was really like telling podcasters, like he had like a whole bunch of rules telling like exactly what to do, which I think.
Can you share that post with me, please? I'd love to see that. I want to know what the rules are.
If I can find it, it's probably way down somewhere.
I think a little banter is good, especially if, as in today's banter, there's a lesson involved.
But even if there's not, a lot of times sometimes you just need to like so-called like warm up the crowd for you don't just get right in. Look, we could in the first second say, okay, let's get into our first call, but maybe some people would want to hear that. It's the same thing when we do our speaking, Rich. When we speak to an audience, let's face it, if we wanted to, we could have like a list of bullet points and teach the whole thing in 30 to 60 minutes.
We'd be out of there in 20 minutes then for a full day course.
But that's not what we're about. That's not what anybody wants to hear.
I agree. But maybe some people are about just getting to the point and banter doesn't come naturally to them and they feel they have to do it and then it's no good. So maybe different strokes for different folks, as they say.
Yeah, I agree. But either way, should we get into our first call?
No, I want to irritate that person. So what's new? I can't stand what's new. I don't like what's new.
I like it on YouTube. You ever see like somebody does a YouTube video and then some hotshot commenter comes on and says, just fast forward to 6 minutes and 32 seconds. That's where the information starts. I mean, is that kind of like, is that done to be nice, or is that done to say like this guy wasted 6 minutes of my time? So just I won't let it happen to you.
You know what my conclusion is here?
What's that?
I'm not on the internet nearly as much as you are.
I have a feeling you might be. You go stealth. I think.
I'm really not. I mean, I certainly didn't see that post about podcasters. All right, should we just get to the point and make that person happy?
Let's do our first call right now.
Okay.
How can I help you?
Hi, Kayla. I just wanted to know how much it is for a cleaning in your office, please.
For a cleaning,
right,
it's $94. But usually, are you a new patient?
I have not been to your office yet. That's right.
Then we would also need to have you have an exam with the doctor. And that would be anywhere like $76 on top of the $94.
So 94 plus about 76, something like that.
Yep.
Okay,
Yep.
great. Thank you very much for that.
You're so welcome.
Great. Okay,
Yeah,
perfect.
thank you.
Perfect. Bye.
Bye.
Oh, okay. Thank you. Oh, no, thank you. No, thank you. Oh, no, thank you. Oh, no, thank you. Oh, no, thank you. Bye. Click.
Yeah, but there were a lot of thanks going back and forth, but
Right.
no appointment was made.
Right. Too much thanking and not enough action. You know what I've also realized in all these calls that we do? Nobody tries to sell their office. Nobody tells you you called the right place, that their doctor's great, that they love seeing new patients. That nothing positive about the practice. It's all very matter of fact, and then usually click.
You know, that's Rich. That's a really good point. That's exactly why I got back to like total basics. I didn't ask a weird esoteric question. I mean, I would have to say that probably the most commonly asked like question from a caller on the phone is, how much is a cleaning in your office?
Sure,
So I wanted total basics. I didn't try to throw her for a loop in any way. And like what you just said, suppose she would have said something like, wow, it sounds like you're looking for a dentist. Is that right? I mean, something simple like that. It would at least warm the person up, get the ball rolling, and get the person into the appointment book. But she just did nothing to make me feel that I called the right office, or worse, to get me into that appointment book.
Nothing. Sounds like you're looking for a new dentist. You called the right place. Let me tell you a little bit about Dr. Grayson. Whatever it is, just something. Let them make it just out of the ordinary. We're so used to the mundane, ordinary, blasé. If you just make it a little bit out of the ordinary, you're going to stand out.
Well, it's a really good point, because let's say this person, who was me, is calling 10 different offices to find out how much a cleaning is. Now, they all say, well, it's but
a cleaning is 23.
Yeah, but if one person, you're right, if one person just said, wow, it sounds like you're looking for a new dental office. Well, let me tell you, you've called the right place. And I would remember that 1 out of 10.
Of course. And then after you picked up the phone because you dropped it, you were so shocked, you would say, I want to come to this office. Let's schedule.
So I have a question. Rich,
it's so simple. It's so simple.
So I've got a question for you. It's a really simple question. I want to see how good you are. You ready?
Okay. I'm up to a simple question.
How come nobody does that? Nobody.
I would say it's training. It's training. I would say just about everyone that we call, there are some exceptions, but just about everyone seems to be conscientious, friendly. They want to do a good job. They're pleasant, and they just don't know to do this. You know, the dental practice, they hire someone, they stick them on the phone, say, when this thing rings, you pick it up and answer the patient's questions. It's simple. Well, it's not simple. It's actually somewhat sophisticated, but I guarantee you that person who you just spoke with, if they learned the skill and knew it and believed it and loved their practice and believed in their practice and their doctor, could easily do that. It's just a matter of knowledge and training.
I want to expand on a point you just made, and what you said is really true. It's not simple, and neither you nor I would ever be on this show saying, oh, you guys are idiots. This is so easy, because it's not easy at all. But it's super, super important. You just heard an office, and you've got a call coming up in a second, but you just heard an office miss an opportunity for not only a new patient, but perhaps we don't know what that other person the caller had in mind, maybe a new family. It's super, super important.
Maybe 5 referrals. I mean, you never
exactly,
know. Yeah.
Exactly. Maybe 5, and maybe this person that called on the phone, maybe, who knows? They asked about how much the cleaning, but they might need $50,000 worth of dental treatment. You never know.
And possibly a budionectomy.
You never know. They might need a lot of stuff.
Yep, you never ever know.
So, I mean, okay, if we're getting into the grading part of this, I'm going to have to give the nice person, she was nice, but I'm going to have to give her a failing grade for sure.
I know. I want to give an incomplete just because I hate to give a failing grade, but I know. But I don't want to lose my tenure as a professor at Maddo University, so I'm going to have to say F. I'm so sorry. With apologies. With apologies. MU. With apologies, I give you an F.
Well, we have one more call today, so maybe that next call it'll be a winner.
You know, I really never know. We're going to find out. We'll find out in just a few minutes. But hey, Dave, I think you said you wanted to talk about the masterclass this time, and we're doing something totally different this time, aren't we?
Yes. You want me to say it first?
Please go ahead.
Well, we're excited because I know if you've been a frequent listener or viewer of this show, we always talk about something that can help you in your practice, and we've always talked about how we have this master class going, and pretty much it's pretty much always been in Baltimore, Maryland, at the Maddow Center for Dental Practice Success. It's a really comfortable atmosphere there, environment. It's been great, but occasionally, Rich and I decide, well, depending on our schedule, where we're going to be, we might want to take it on the road a little bit. And it just so happens we're going to be speaking in Charlotte, North Carolina very, very soon. Actually, we're speaking there on Friday, March 13th. Oh, wait a minute. It's Friday the 13th. We're speaking.
Perfect.
Cancel.
No way. I say double it up, baby.
It could be our lucky day.
Yeah.
But anyway, we decided.
I don't have tristodecaphobia. I don't know if you do.
What phobia? What a who?
Tristodecaphobia.
Oh, I've got a little bit of tristodecaphobia. Okay. But anyway, we're going to be there. We're going to be comfortable. We're going to be there anyway. So we said,
be numb.
Why not do a master class where we're going to be? We're going to be in Charlotte anyway. We'll bring one of our coaches in. We'll bring some of our team, whatever. And we're going to have a great day in Charlotte, North Carolina on Saturday, March 14th, as we do our masterclass. And if you're brand new to us, if you've been listening for a while, you know about our masterclasses. But if you're brand new, just real briefly, it's a day that we sit down with you. It's doctors only, pretty much. We limit it to a very small group, around 8 to 12, somewhere. It varies a little bit. But we spend the day with you and troubleshoot and brainstorm and mastermind and really do whatever we can to help you and show you how to get your practice to that next level, to be more successful. If you're having a struggle, a hurdle, whatever it might be, we show you how to get past that and really love the practice of dentistry and be more successful and more fruitful. So that's what it's all about. Go to masterclass.maddow.com and you will see not only our schedule, if we have anything in the future. We usually do these, Rich, every
quarter or so,
every month or two, something like that. Yeah, it could be anywhere from 1 to 3 months, something like that. But you'll certainly see we're going to be in Charlotte. And if we have another date planned, well, it'll be there, but we may or may not. So we'd love to see you in Charlotte, North Carolina.
Charlotte. And Joseph's going to be in Charlotte from what I've heard.
He's always in Charlotte, supposedly.
Yep. Is Cary, North Carolina, a suburb of Charlotte or Raleigh-Durham?
I think it's a suburb of Raleigh-Durham, I believe. Okay. It's next to Raleigh-Durham.
Well, but if you're in Cary, you're still allowed to come to Charlotte, right? It's not that far. What is it, a 3.5 hour drive? Something
I
like
think
that.
I think less than that.
That's nothing.
Well, I got it. Well, you might have to speak to Cary. I'm not sure.
Anybody with caries is welcome. Hey, I'm going to be real quick, and then we're going to get to this next call. But about a year ago, we were kind of reviewing all of our expenses at the Maddow Center, and we realized we were paying too darn much in our credit card processing. So we went on a little research project and found this company, Fat Merchant, who is truly a disruptor in the credit card industry, just like Amazon and Lyft and eBay were disruptors in their industries because they don't charge an overage percentage. Now, you still have to pay your percentage to MasterCard and Visa, of course, but Fat Merchant doesn't charge you a percentage like every other company does, just a low monthly fee. We started using them. We saved money instantly. We loved it so much, we told our colleagues to use it in their practices. They're saving money instantly, and you should too. So just go to maddow.com/save. Maddow.com/SAVE. You can learn a little bit more about it. You'll get a free terminal when you sign up through that page. There's no obligation. Fat Merchant will contact you and show you how much you'll save every month. So check it out. You'll love it. We love it. Everyone's happy. We love it when everyone's happy, don't we?
And Rich, doesn't that say it all? Maddow.com/save. I mean, even if you're not sure if you want to do it, go to that site, go to that page anyway, because it's a pretty cool page, and it'll show you how you can save for sure.
Save every month. Just like Debbie Ray.
Every single month.
Cool. All right, let's do our second call.
Hello, you have reached Dr. office. We appreciate your call. We are currently helping other patients. Press 1 for assistance or press 2 to leave a detailed message.
I pushed 1.
Dr. office, this is Mackenzie.
Hi, are you seeing new patients in your office?
Yes, sir.
Good. And what's the first appointment usually consist of?
Normally it would just be like if you wanted a cleaning, you would do it like an exam, prophy, and x-rays if they were needed.
Mm-hmm. What's prophy mean?
It just means a cleaning. Sorry, I should have clarified.
No problem. Well, thank you so much for the information.
Yeah, you're welcome.
All right. Bye.
Bye-bye.
Well, Rich, I think.
I know there's so many things you want to say, right?
Well, first of all, I think that was back to basics. That was great. It was a great call. I think very similar to the one just back to the basics.
Yep.
Give them the best chance possible without trying to even throw them for a loop at all. But I just want to comment on the very first part of the call. And it was a recording. It said something like, "We're busy doing something, but press 1 if you want to talk to somebody." And meanwhile, she came right on the phone. They're not busy doing anything. Why couldn't she just answer the phone?
My first comment exactly. What was that all about? First of all, we don't like it when the first thing you hear is a recording. But if you have to do it for some logistical reason, which I don't think you do, but if you have to, that recording, the first thing it said was, "Thank you for calling Dr. Blank's office. We're busy seeing other patients." Right. Well, click, hang up. Before obviously we're doing secret shopper calls, so I hung on. But if I were a new patient, I would have hung up right at that spot.
Yeah,
and then they said, press something to leave a message, press another one for assistance. What's going on? Then you press it, as you said, they answer right away.
Right away.
Why was that recording necessary? They weren't seeing other patients. You should never have a recording like that anyway. Whew, and horrible start.
And why would you even give somebody the opportunity to leave a message? Why would you ever do that? Okay.
Yeah.
Now that we totally mutilated that part. Now what's next?
Based on that alone, I say they fail, because that was a horrible way to start the call. Then she came to the phone right away, which I wasn't expecting because I deal with that recording BS.
I thought she was going to have like blood all over her hands and everything,
Exactly, blood on the tracks. And I asked about a cleaning, and she said, well, an exam and a prophy, which, come on, people don't know what a prophy means. And then, boom, nothing. Went nowhere.
I don't know what to say. I mean, we could reiterate what we said on the last call, but again, we got back to basics. She did nothing to wow you, the caller, let you believe that this is the right office. Thanks so much. It sounds like you're looking for a new dental practice. We'll look no further. Blah, blah, blah.
Right.
Nothing.
So pretty much same comments as last call. If you said that every call has like an arc to it, like a movie, a beginning, a middle, and a closing. Just developed a lisp. A beginning, a middle, and a closing. She failed all three. Well, the recording failed the beginning. Then using the word prophy and not giving any information or anything exciting. And then, boom, no, let's make an appointment for you. Triple F.
You know what I think one of the problems might be, though, is that the person, and nothing against her because it's all over, but
it's ubiquitous.
It's ubiquitous. I was looking actually for it's ubiquitous. It's pervasive. It's every okay. So she is like immersed in the dental practice all day long. This stuff is going on it's like second nature. But the caller, so she's like just giving these terms. Oh, you come in, you get a cleaning, you'll get a prophy, you'll get an, it's like nothing to her. But it's got to be something to her. It's got to be something that stands out and very, very special as opposed to mundane. Okay, yeah, you come in, we're going to do this. Nothing.
Yep. The same goes for the clinical area, because doing a crown prep is nothing to us. But that patient could be scared crapless. It's a big deal. They're telling all their friends, oh, I'm so nervous, I've got to go to the dentist to get a crown. Oh, I had that done, and yeah, they poke your gums with this BS and put the good, it's horrible. It's a big deal to them. It's nothing to us, but we need to treat every patient, I'm talking about the clinical area too, like their procedure's a big deal, and make sure they're comfortable and they're totally numb and they're informed and all those things. It's not nothing to them. It's a big thing to them. It's a big deal to them, as the late Simon Maddow would have said.
So I can't remember if I gave my official grade, but again, my official grade has to be fail. I had to say it.
I gave a triple F.
You did. I want to pass somebody so badly, but I just, they've got to earn it. They have to earn it.
My suggestion, if you want to pass somebody, is go in your car, get on I-70 right now, get in the left lane, and just put it pedal to the metal. And you will pass someone, I guarantee.
It would take me way too long to get to I-70. I might do it on. Is it okay if I do it on I-80? Is that all right?
Do it on 80. That's fine. Okay. I'll do it on I-95. I can be there in just a few minutes. All right. Well, thanks again. Hey, let us know what's going on. Send an email to info@maddow.com. Comment. Request a topic. Tell us that you want us to call your practice, whatever it is. And then if you could please do us a big favor, it keeps the lights on, as we say. Go on iTunes or whatever medium you're using and give us a good rating and a good write-up. We'd really, really appreciate it. And tell your friends. all your friends. Every one of them.
All your friends. All friends must pay. Anyway, puts another episode in the record books. I'm Dr. David Maddow.
Dr. Richard Maddow, thanks so much for listening to the Dental Practice Fixers podcast.
See you next time.